Well, Democrats are close, as we know, to passing historic legislation that would provide health coverage to 30 million uninsured Americans. There is, though, still a lot to be debated, like the cost of the plan, both in the House and in the Senate, and whether or not we can afford them. I'm joined now by University of Maryland International Business Professor Peter Morisi in Washington. Welcome, Peter. And also joining us.
Nice to be with you.
Thank you. You too. And also joining us from Atlanta this morning, Emory University Health Policy Professor Kenneth Thorpe. Kenneth, thanks for being here as well.
Well, good morning.
And Kenneth, let me start with you. When it comes to the cost, President Obama has said that if we don't pass health care reform, that people's premiums will go up anyway, the federal government will go bankrupt, Medicare, Medicaid are unsustainable. Is it disingenuous, though, to say that this bill is actually going to result in lower health care costs for the average person?
Well, it will for millions of Americans, for sure. If you buy coverage today in the individual market, you're self-employed, for example, 18 million of those individuals will actually pay about 60% less for their health care than they would if we didn't pass this reform bill. About 93% of Americans with health insurance today, according to the Congressional Budget Office, would actually pay a little bit less for their health care. And finally, we're really on the road to trying to get the Medicare program more efficient and better quality. So a lot of the savings built into the program are really dealing with efficiencies, reductions in readmissions to the hospital, preventing unnecessary admissions to the hospital. So it's a good start, absolutely, going in the right direction. Could we do more? No question. But I think this is a bill that if we don't pass it, Americans would be worse off.
Peter, you're critical of it. I read your column yesterday about this. You believe that some of this is really backloaded, as you put it, and that some of it is accounting maneuvers that aren't necessarily going to lower costs. Why do you think this is ultimately not going to result in lower health care costs?
Well, for one thing, most of the additional revenues come in the first 5 years, and then we have a lot of burdens from year 5 through 15. If you look at this, the period between 2014 and 2024, this thing is likely to substantially add to the federal deficit. We're going to increase the demand a great deal for health care services. This bill assumes that costs will go down. For example, it's going to cut Medicare reimbursements next year by 21%. That's absurd. That's not going to happen. The history of these things tells us that, and then keep them constant. No, there's a lot of assumptions in this bill that really are kind of nefarious, and I believe that the typical American family will pay $1,000 to $2,000 more for coverage for a family of 4.
Kenneth, what about that? There are a lot of different ways to analyze this. There are some groups who are drawing on their actuarial charts and tables that say it will end up costing more. Obviously, for people who don't have insurance now and pre-existing conditions, those people are going to see a benefit here. But ultimately, how are costs going to go down? How are they going to be realistic about things like dropping Medicare costs, lowering Medicare and Medicaid costs over the next few decades?
Well, Kieran, you're right. I mean, millions of Americans that don't have coverage today are certainly going to see a substantial benefit with this legislation. Individuals that can't get coverage because they have a pre-existing condition. Here in the state of Georgia, if you're self-employed and you've got diabetes or if you've got skin cancer, you can't get coverage. They'll be able to get coverage under this bill. Fortunately, we have a nonpartisan group that's looked at this, the Congressional Budget Office. And they've come up with the following conclusions. First, it will reduce the deficit by triple digits, not only over the next 10 years, but over the next 20 years. So they're the experts that Republicans and Democrats rely on to be nonpartisan and impartial in this, and they've decided through their analysis that this will be deficit reduction. And as I mentioned, as you buy coverage in the individual market, people in that market, 18 million of them, will pay about 60% less for their health insurance. Could we do more? Sure. I think a lot of us are dissatisfied with the extent of the changes in it, but boy, it's sure better than doing nothing.
Peter, who do you think the winners and losers are in this, if you had to break it down simplistically?
Well, the winners are those that have to buy insurance individually, the self-employed, who are not part of some sort of group, say a realtor that can hook up to the real estate association, and those people that can't get it. Now, in many states, we do have community rating, and insurance companies are required to take all comers. For example, Maryland, where I work, that's the case. We could accomplish those reforms without as much as what's going on in this bill. The losers are people that typically are moderate income, maybe make $40,000 to $100,000, have group coverage with their employer. They'll be the cost of that coverage will go up quite substantially, and either their employer will pay them less or charge them more. And also, a lot of these employers will have incentives to do rather strange things. Turn them into contractors so they can qualify for subsidies under this, quasi-government plan, whatever ultimately emerges. A lot of employers may end their programs and just tell them, I'll pay the tax, the fee for not covering employees, and tell their employees to go get insurance on their own. The fallout from this is going to be rather significant and substantial. I've examined the Congressional Budget Office studies, and as an economist, I can tell you they're making an awful lot of courageous assumptions, the kinds of assumptions that should not be made in something this large over 15 years.
All right. Well, we're going to have to leave it there. Very interesting discussion this morning. Peter Morici, Kenneth Thorpe, thank you.
Thank you.